Once again, this is Dr. Yvette Mong Batar, your inculcator for this module. So, in this set of slides, we will be learning about family nursing diagnosis. So, this family nursing diagnosis is formulated at several levels, as individual family members, as family units, or as the family in relation to its environment or community. So, I guess you are familiar with NANDA 1, the one you took up in your first year. So, the NANDA 1 serve as common framework of expressing human responses to actual and potential health problems. Then, the Family Coping Index is another way also of formulating diagnosis, the one we took up in the first set of slides, which is, as mentioned there, an alternative tool for nursing diagnosis. Concepts included in this video presentation includes formulating nursing care plan and implementing family care plan. So, for formulating the plan of care, it involves priority setting, establishing goals and objectives, and selecting appropriate family nursing interventions or strategies. So, the nurse role in the formulation of nursing care plan is to offer guidance, provide information, assist family in the planning process. But then, in the end, the family decisions regarding healthcare have to be respected. So, we nurses, should remember that the family's benefit must never lose sight of the fact that the family has the right to self-determination. So, we are only there to give or offer our guidance to help them come up with a decision, but we do not decide for them. Then, we also have implementing family care plan. Under that, we have the categories of intervention. So, for that, we have promotive, preventive, and rehabilitative. So, we even have the curative. No, so I'm so sorry. I wasn't able to place it there. But, I will include that later, no, as we elucidate that part. Okay, we move on to priority setting. So, this is determining the sequence in dealing with identified problems. So, this is necessary to be done because the nurse cannot possibly deal with all identified family needs and concerns all at once. So, we have here a guide in priority setting. First, we have is the family safety. So, a life-threatening situation should be given top priority. Communicable diseases like the very famous COVID-19 requires immediate attention to promote healing and prevent spread to susceptible family members. Next we have is family perception. So next to life-threatening are the emergencies. So priority will also be given to the need that the family recognizes as most urgent and or important. So if the family fails to recognize issues that affect family safety, the nurse should educate the family. Then third we have is practicality. So here the nurse, together with the family, looks into existing resources and constraints. Are the resources required to address a particular need available to the nurse and the family? Does the nurse have the necessary competence to deal with the situation? So, it should be that practicality will also be considered. Last but not the least is projected effects. So that is the immediate resolution of a family concern gives the family a sense of accomplishment and confidence in themselves and the nurse. So that is also providing a clear-cut intervention during a family nurse contact, which raises the family's level of trust with the nurse. Then, we continue with establishing goals and objectives. So, goal is a desired observable family response to planned interventions in response to a mutually identified need. The end that the nurse and the family aim to achieve. So remember that when we set our goals and objectives, we have to set realistic ones. So we set realistic goals, so meaning it is within the limits of the family resources. So the likelihood of attainment of goal is higher if the family owns the goal and if it is achievable within the existing family situation. We continue with establishing objectives. So objectives are the desired step-by-step family responses as they work toward a goal. This is used to measure family achievement for monitoring and evaluation. So our objectives should be a workable one. So it should be SMART, meaning it should be specific, measurable, attainable, relevant, and time-bound. Then, we also have to determine appropriate interventions, which will depend on the identified family needs and the goals of objectives. So, we have three types of interventions. We have supplemental interventions. So, these are actions that the nurse performs on behalf of the family when it is unable to do things for itself. So like for example, direct nursing care to a sick or disabled family member. Then we have facilitative intervention. So this refers to actions that remove barriers to appropriate health action. Like for example, assisting the family to avail of maternal and early child care services. Then the third one we have is developmental interventions. So this aim to improve the capacity of the family to provide for its own needs, like guiding the family to make responsible health decisions directed towards family empowerment. So we have to empower also the family, as mentioned in our first set of slides, that in community health nursing, we promote participatory approach. So interventions may be a mix of two or all of these categories. So the nurse must make sure that interventions are appropriate to the family situation. Like for example, overuse of supplemental interventions may hold back development of self-reliance. We move on into prerequisite to designing an effective family care plan. So, for that, we have principle of mutuality. So, that means that the family is given the opportunity to decide for itself how they can best deal with a health situation. Then, we have principle of personalization. So, this requires that the nursing care plan fits the unique situation of a family. So meaning, it will fit their needs, style, strengths, and patterns of functioning. Then, the coordination. So we have to coordinate with other members of health team and other agencies involved. Harmonizing services prevents confusion and promotes performance of desirable behaviors. Then last but not the least, we have nurses' capacity of defining self. So many times, the demands of family health care will be greater than the resources available to the nurse and the family as well. So the nurse has to delineate, so meaning to say, the nurse has to define, has to outline the purpose, the resources available. So when we talk about resources, we are talking about competencies, time, and material resources. And of course, we also have to consider the limitations. So that process affords a realistic view of the situation, allowing the nurse to be more effective and avoid disappointments or frustrations. Also, having a clearly defined values and beliefs allows the nurse to work with family in an ethical and considerate manner. The defining self. So defining self promotes the nurse awareness of own behaviors. Recognition of having an idea or behavior that may affect effectiveness allows the nurse to address the issue appropriately. So once we already have designed the family care plan, then we are now to implement that plan of care. So implementing the plan of care is the step when the family and or the nurse execute the plan of action. Its pattern is determined by mutually agreed upon goals and objectives and the selected courses of action. So the courses of action involves providing nursing care, helping family members do what is necessary to meet health needs and problems, and referring the family to another health worker or agency if it is necessary. So, the nurse should be conscious of possible barriers. Okay? So, barriers that could be family or nurse related. So, family barriers include apathy and indecision. Okay? So, when we say apathy, that is unresponsiveness, okay, of the family, which may be a manifestation of the family's feelings of hopelessness and powerlessness. Indecision may result in family allowing events just to happen since they cannot make a decision. So if no decision, it would mean that no action also. So the nurse has to exert effort to find what is actually happening to the family to be able to effectively deal with the barriers. So, the barriers could also be nurse-related. So, like imposing ideas. So, that keeps the family from taking responsibility for decision-making and appropriate action. So, which should not be done. No, as mentioned, we nurses are there only to guide the family, okay, to help the family come up with a decision, but we do not decide for them. So meaning we do not impose our ideas to them. Okay, another one that is a nurse-related barrier is negative labeling. So like labeling the family as stubborn, matigas ang ulo, kahig ulo, kahit ginang ulo. So like the nurse will label the family as stubborn if unable to comply with instructions. So that may also lead to that would also lead the nurse to label himself or herself as ineffective. Another barrier that is nurse related is overlooking family strengths. So usually results from tendency of the nurse to focus on family problems and weaknesses. And then another barrier that is nurse-related is neglecting cultural and gender implications of family interventions. So that will make the plan unacceptable to the family since it is not in accordance with their culture. We continue with categories of interventions. So nursing interventions are actions a nurse takes to implement their patient care plan, including any treatments, procedures, or teaching moments intended to improve the patient's comfort and health. So, as seen in the slide, we have there promotive, preventive, curative, and rehabilitative. So I won't go in detail anymore on these categories of interventions since you have took these concepts already in your first year. But then I would just like to mention in passing that when we talk about promotive interventions, these are interventions that is motivated by desire to increase well-being and to reach the best possible health potential. Like for example, performing periodic health examinations and information dissemination. Preventive are interventions that stop the disease before it starts, like vaccines, seat belts, no, when we are inside the car, of course, a moving car. So, which is motivated by avoidance of illness, exercise, good diet, cessation of smoking. Then we have curative. So these are interventions that tends to overcome disease and promote recovery, like diagnosing and treating illness and injury. So specific example for that, remedial surgery or herbal remedy and the like. Then rehabilitative interventions are those interventions whose goals are to return to healthy state or to progress to their highest level of independence by monitoring and treating illness and disability. So actually, we have other categories of nursing interventions. So sometimes the nursing interventions are grouped into categories according to the role of the healthcare professional involved. And I am sure that you are also familiar with this, no? The independent interventions wherein a nurse can perform independently, meaning they can perform it on their own without assistance from other medical personnel, no? And then like checking of vital signs, diba? That is independent. The dependent, so would mean that some actions require instructions or input from a doctor, like for example prescribing new medication. So a nurse cannot initiate dependent interventions alone. So like giving of antibiotics, so for that we really need the doctor's order. Then the interdependent, so that is a collaborative or interdependent interventions which involve team members across disciplines. So in certain cases, such as post-surgery, the patient's recovery plan may require a prescription, medication from a doctor, feeding assistance from a nurse, and treatment by a physical therapist or occupational therapist. Then the implementation. So we could either implement our plan of care through family service and progress record or the family case study. So the family service and progress record is the folders. No, so these are folders that kept for each family and its members where all pertinent data are recorded. The family case study are records of glaring family problem cases, which will be the one that you will be doing in your next CHN. Okay, so after we are done with the implementation, then we will now do evaluation. So evaluation is determining the value of nursing care that has been given to the family. So it is the product of this step that is used for further decision making, whether or not to terminate, to continue, or to modify the interventions. So a well-formulated goals and objectives in the care plan will serve as the framework for our evaluation. So we have this formative evaluation, we also have the summative. So formative evaluation is the judgment made about effectiveness of nursing interventions as they are implemented. So that is ongoing and continuing while the family care plan is being implemented and the family nurse interactions are taking place. Results of the evaluation will guide the nurse and the family in updating the plans as necessary. Then the summative evaluation is determining the end results of family nursing care. So it involves measuring outcomes or degree to which goals have been achieved. We will now continue with the aspects of evaluation that are useful in family health care. So for that, we have effectiveness, which is the determination whether the goals and objectives were attained. So that will answer the question, did we produce the expected results or did we attain our objectives? Then, appropriateness. So that refers to suitability of the goals and objectives and interventions to the identified family health needs. So that answers the question, are our goals or objectives and interventions correct in relation to the family health needs we intend to address? Another one is adequacy. Another aspect of evaluation is adequacy. It means the degree of sufficiency of goals or objectives and interventions in attaining the desired change in the family. So that answers the question, where are interventions enough to bring about the desired change in the family? Then lastly, we have efficiency, which is the relationship of resources used to attain the desired outcomes. So that answers the question, are the outcomes of family nursing care worth the nurse's time, effort, and other resources? Before we end, we go into the key points for this module. So the family is a client, not just part of the context of an individual client. The nurse assesses the family, its individual members, and as a whole, and its physical and social environment. The nurse identifies family health problems, either it's a health threat, health deficit, and foreseeable crisis. After identifying the family's health problems, then the nurse establishes whether or not the family is performing its health task. And that is the end for this module. Thank you for your attention. God bless us all.